For today's demonstrations, you would notice that I'm not placing my stethoscope diaphragm directly on their skin, and that is not the correct way to do it. That's just for the demo purposes. However, in clinical setting, you will need to put stethoscope diaphragm directly on clients' or patients' skin to get that assessment piece correctly. And even when you are checking their skin, you will be exposing the patient to assess it appropriately.
Come on in.
Hi, my name is Preet, and I'm going to be your nurse today. How are you doing today?
I'm doing good.
Okay, I'm going to just wash my hands real quick, and I'll be right with you, okay? I'm going to check your armband and ask you a few questions. Okay. Can you tell me your full name, please?
Seer Gill,
Okay, and your date of birth?
October 30th, 1999.
Okay. Do you want to be addressed as Ms. Gill, Seerath? How do you want to be addressed?
Seer is fine.
Seerath is fine? Okay, thank you. I don't see any allergy band here. Do you know of any allergies that you have?
Not that I know of, no.
Not that you know of? Okay, that's good. So what we will be doing today is I'm going to just put these curtains around for privacy, and we have to start doing head-to-toe shift assessment. But for the starters, what we need to do is check your blood pressure, temperature, and I'll be asking you a few questions. Is that okay with you?
Yep.
Okay. Do you have any pain today?
No.
Okay. If you had to give it a number from 0 to 10, 0 being no pain at all, 10 being the worst pain you have ever had, how would you rate it?
I would say 0.
0, then no pain. Okay. Let me get started with checking your blood pressure. Okay. I will be putting this around your arm, and then I will be using this to pump it up, and it will be a little bit tighter on your arm, and I will be listening to different sounds there, and it will give me a blood pressure reading. Okay. Let me bring my stethoscope here. This will go around your arm here. Okay, you can relax your arm. Okay. Before I put my stethoscope on you, I'm going to go ahead and cleanse it so that I'm not putting any of the germs on your arm there. We'll cleanse the earpieces too. Okay, I'll let it dry. And I'll warm it up before I put it on there. Okay. And before I do anything else, I'm going to go ahead and find your brachial pulse. So what I'm going to do is pump it up until I don't feel your brachial pulse anymore. Then I'll pump it up a little bit more, like 20 to 30 millimeters per mercury, and then I will put my stethoscope up there. Okay. I received the reading of 110 over 70. Does that sound about right for your blood pressure?
Yes.
Okay. Let me take this off of you. Okay. Now what I'm going to do is I will do two things side by side. I will be checking your temperature. So I'm going to put this underneath your tongue. So you just need to kind of keep your mouth closed around it for about a minute. And while that is getting done, what I will do is put this pulse oximeter on your finger after I cleanse it with alcohol swab. Are you okay with me using the alcohol swab on your finger? There are no cuts or anything like that over there? Okay, that's good. So I will be doing both of those readings, okay? This goes underneath your tongue. Any finger preference?
Mm-mm.
Okay, use this. This is cold and wet. I will let it dry. Okay. Okay, so it's giving me a reading of 98% oxygen saturation on room air, and it's also giving me your heart rate 89 beats per minute, but we will be checking that via stethoscope too when we get to it. And I'm going to go ahead and cleanse your finger one more time, cold and wet again. Okay, I'm going to go ahead and take this out. Thank you. So what I have here is 98.4 degree Fahrenheit. Okay, so that is really good.